of the successes that we've had with getting supplies here in Monterey County. And then finally, before I turn it over to Mike, I wanted to note that I understand that the EOC has or will move to level 1 emergency designation, and that would just mean that we are opening up different sections of the EOC and having different resources available for the EOC, and that's really important to make sure that we get a handle on everything here and follow a nice orderly process the way that they do in the EOC. They're very well organized, and they run like a military machine, like you want it to run in a situation like this. I do see Gary Millay on. Before I turn it to Mike, I think I'll turn to Gary and if he has any updates on the EOC situation.
Yeah, thank you, Charles. So the Emergency Operations Center has activated to level 1. That's our highest level of activation. We currently have 70 units, branches, and sections activated at this time. Our operations section, which does most of the work that is seen out in the public, comprises our care and shelter branch, our medical health branch, our alternate care branch, our support services branch, and our fire and law branch, our emergency response branch. And each one of those branches has anywhere between 4 to 6 units underneath them to support the activities that are happening within that branch. So currently, the Emergency Operations Center is ready, and I'll let Mike speak to the specifics of it, but we're ready to house any patients that are being discharged from the hospital that still need separation into local hotels. We are working on a plan to have isolation centers around the county so that we can keep COVID positive patients away from the general public. And as part of that plan, we have, as Charles mentioned, received a commitment of 90 to 100 travel trailers from FEMA and the state that will be utilized in various areas around the county for the same purpose. If with that update, I'll entertain any questions. Otherwise, I'll turn it back over to Charles to give to Mike.
Mike, why don't you go ahead and take over from Gary since we're on the EOC?
Sure, I'd be happy to. Well, thank you. As mentioned, I'm filling the role as Logistics Section Chief for the County Monterey Emergency Operations Center. Some of the challenges that we've been facing since the start of this pandemic is resources, competing with other jurisdictions and getting resources. But luckily, what we've been able to do is work with our community-based volunteer groups in identifying resources. We had a group out of Marina that we've connected with that helped us identify 10,000 N95 masks from overseas. We were able to work with them and broker through them the process of procuring those masks, which are on their way, should be arriving today to our logistics section. And we're partnering with other community-based organizations as well, so we're having some success there. But as everyone knows, during this time, we get a lot of interested parties that want to sell us items, and sometimes they're not legit. So we're having to do extra work, 3 levels of checking to verify to make sure that companies that are offering their services or goods are really legit and they're not scams. So that's one of the difficulties that we're facing, is just that extra workload. We've been in support with the EOC, with the Monterey County Health Department, working through the Mohawk, which is medical supply requests. To date, we've filled roughly 260 Mohawk requests for medical supplies throughout the county. That's to county hospitals, clinics, public safety, fire, police departments throughout Monterey County. And together we filled 53 web EOC requests, which are internal requests for support services for all the branches that are operating within the EOC. So we've had success, and we've had challenges, but we're getting through those with the community's help.
Thanks very much, Mike. We'll save questions for later because we've got a few other people who are going to give us some updates on county operations. Elsa Jimenez, our Health Department Director, is on the line, and she's going to tell us more about Public Health Week. Public health has never been more important than it is right now, but there's a lot more that goes on behind the scenes. Elsa?
Sure. Let me go ahead and start my video. Good afternoon, everybody. I'll just take a few minutes of your time to give you an update on what we plan to do this year to help promote public health during this annual celebration around the nation. Of course, considering with the fact that we can't proceed as originally planned because of our shelter in place regulations and everything that's happening around our response for COVID-19. So all jurisdictions across the nation are celebrating National Public Health Week this week. Each day there is a different theme. For example, today focuses on mental health, tomorrow on maternal and child health. And our health department is going to be pushing out messages through social media, as well as encouraging individuals to participate on national Twitter talk. So for example, tomorrow our message will go out encouraging people to take a walk. And we're encouraging them to take walks in their neighborhoods, to practice social distancing, to make sure that they're wearing appropriate gear so that they're easily visible to traffic and others, and encouraging them to join a national conversation around the importance of walking. So that's kind of just a tidbit of what we plan to do this week through Sunday when National Public Health Week ends.
Thank you very much, Elsa. And we also have Leanne Magowski on the line. She is our Director of 911, and they're the very important public safety aspect of our county. And she's going to give us an update on how 911 has been handling the crisis, the COVID crisis. And there she is in the 911 center.
Well, I am working remotely, but I did not want anyone to forget the great work that our dispatch staff is doing. As always, 911 and our non-emergency lines are there for you for your emergencies and your police and fire needs. If you have questions about COVID, it is really important that you continue to call and use 211 or use online resources and save your requests for emergencies and for non-emergencies for police and fire to call us. We do have some caller questions to ask if you or the people in your home have any symptoms to help prepare our first responders. And if it is a call that can be handled by phone, many agencies are choosing to handle calls by phone for not only their safety, but your safety as well. We are here for you day and night. And I just want to report that we hope that everyone is healthy and safe.
Thank you very much, Leanne. And then we also have Under Sheriff John Mineau on the line. There are a lot of questions about enforcement with the new updated shelter in place that was reissued, and he has an update and information on that.
Thank you, Maya. Can you hear me okay?
Sure can.
Thank you. So as we talked about this quite a bit at the Friday briefing right after the updated health order came out. Obviously, our goal, the health orders, the order for the shelter in place, we treat that just like we would any other law. The greatest tool for compliance is for people to just comply. And so we're still encouraging people, stay at home unless you have to be out. We're still going to, if we contact large groups or get reports of large groups, to the extent that we can do that via disperse order, we will. Those folks that just choose to openly defy the health officer's order, we can take an enforcement action. We did over the weekend. Our deputies responded to actually an event that involved a collection of folks that are rooster fighting. And not only did we take the enforcement action based upon the laws related to the rooster fighting, we also took enforcement action based upon the health officer's order. So we really want people to stay home and stay safe. But we are prepared to take the enforcement action if that's what is required to get people to comply. And that would conclude my report.
Thanks very much, Under Sheriff. And now we've had our presentations and the county staff that's on the line is available for questions. Please you can either use the hand raise function, the chat function, or ask your question the good old fashioned way via audio. So again, the floor is open for questions. Any questions for any of our county staff today?
With the FEMA trailers, this is Caitlin with KSBW.
Thank
With
you.
the FEMA trail, thanks. Sorry, I was trying to chat and I couldn't. With the FEMA trailers, are these the ones that the governor had provided? I think it was 1,300 and then the count went up. I don't know what the latest count was for alternative care sites for the homeless. Is that part of, are these a portion of those FEMA trailers?
It's the same principle and the guidance document that the governor put out. However, those trailers have all been utilized by the 10 largest cities in the state. So the governor has, because places like Monterey County that aren't the 10 largest still need a significant amount of support, they are actually purchasing trailers for us for that reason. But so they're not the initial 1,300, they're in addition to that, but we are getting brand new travel trailers, compliments of the state.
Thanks very much, Gary. Are there any other questions?
This is Caitlin with KSBW again. You mentioned that there were some industries that were pushing to be deemed essential and that they could safely operate. What industries were those?
Well, excuse me, it's Charles McKee. The obviously the agriculture industry is an essential business, and so they're pushing to, you know, obviously to stay open. But the construction industry has been one that has been pretty good at maintaining social distancing in their operations, and they've proposed different measures, as far as I know. And I know that there are a lot of workers here in Monterey County that work in the construction industry that this is going to be a big impact on. And so there's some push to see if there are ways to allow them to continue working while following good social distancing protocols. Some of the construction industry are working outdoors, and either one or two people that might be on a site. Obviously, we don't want construction crews driving together to sites if they're not going to be able to have the appropriate social distancing. But that's one of the industries that's been pushing to have be allowed to continue during the shelter-in-place order. I will note that in the order itself, there are exceptions that allow construction for maintaining essential functions, maintaining work sites so that they're not a danger, health and safety danger, and as well to help push for affordable housing here in Monterey County.
Thank you, Charles. Are there any other questions?
Yeah, Maya, it's Mary from the Monterey County Weekly. Carl Holmes sent out what I think was probably a well-meaning press release yesterday about parks being open for Easter weekend, and it seems the entire county has collectively lost its shit over it. What's going to happen as a result? Is this order going through? Should people be going to parks at this time?
I don't think Carl's on, and so I will try to field that question. The message from the Parks Department was consistent with the general shelter-in-place order, in the sense that Dr. Mineau was urging people to get healthy activities going, obviously exercising in the more remote type of parks where you can hike on trails and maybe bike on some trails that might be conducive to keeping your mental well-being as well as your physical well-being at this point. The message that goes out is to make sure that there are no congregations happening at any of the parks. The parks that the county generally operates are more open access type of parks and not playgrounds and those kinds of areas where people would congregate, similar to what some of the bigger state parks and the National Monument have, the open space kind of parks rather than the playground type of parks. However, with that said, we also recognize that Easter weekend, Easter Sunday, and that weekend is a time when many people here in Monterey County especially do congregate in parks and have big events at the parks. And so we're going to need to look at whether there's going to be a need to close down the parks for Easter Sunday, just so that we don't have, and maybe even Easter weekend, just so that we don't have the congregations that normally happen for that religious holiday. We recognize that there's differences of opinion out there as far as the appropriateness of having a shelter-in-place order, at the same time encouraging people to go to parks and recreate, and the challenge of finding the balance of encouraging people to exercise versus limiting congregations is not an easy one. We've also sent out similar messages to the faith-based community to make sure that they're not having church services where congregations are meeting in a physical location, but rather they're trying to do their church services remotely over Zoom and other media platforms. But as far as the county parks itself, we're going to have to relook at whether the allowing it on this Easter weekend is advisable at this time, and we may send out a revised directive on that.
Right, thank you. Are there any other questions?
Yes, this is Kelly Nix from the Carmel Pinecone.
Hi, Kelly, go ahead.
Yeah, Natividad Medical Center last week would not give us the number of ventilators it has in stock at the hospital. Could someone in the county tell us the number of ventilators it has?
Kelly, I don't think the Natividad is on the call today, but we can forward your question.
Yeah, we can do that. I don't know whether the other hospitals have provided that type of information.
They did provide them to me, yes.
I'm sorry?
They did provide, the other hospitals did provide that information to me.
That's great. So I think that's some good information to have. I think that the risk of putting out information about the number of ventilators doesn't answer the full question about how many are in use right now, how many are in use for other reasons, what does it take to operate a ventilator, what are the medications, what are the staffing needs, what are the ICU setups that are required. So the number of ventilators isn't the full answer to the needs of patients that might require ventilator type of services.
Which makes you wonder why they won't give us the information. But
I think the point is that we don't want to have misinformation out there or people extrapolating from just having the number of ventilators as the answer to just, what do we need here in Monterey County? It's a more complex discussion than just the number of ventilators.
But we will forward your question to Natividad. Any other questions for any of our county staff on the line?
I have a question. This is Joe Livernoise.
Hi, Joe, go ahead.
For Under Sheriff John Mineau. So you teased us with the cockfight, but what are the who, what, when, where's, and whys? When did this happen? How many were cited, et cetera, et cetera?
Actually, one of our PIOs, John Thornburg, is actually in the office. I'm telecommuting today, so if you'd refer those, I know John's got all of the who's, what's, whens, and he already started fielding media calls on this about 9:30 this morning. So he's got the full verse on that. So if you direct those questions to him, he can give you the full report.
Great. Are there any additional questions? All right, we've nothing in chat, no additional questions. If there are,
I have a question. This is Jim Johnson with the Herald. Yeah, I'm wondering, I guess this is for Elsa in the absence of Dr. Moreno. How is the just wanted to confirm that there are 2 confirmed deaths from coronavirus so far in the county, and I just wanted to also see that only includes county residents, right? Regardless of where they are when they pass away, and wouldn't include then also anyone from outside the county who happens to die while they're in the county of a coronavirus-related death.
Hi, this is Elsa Jimenez. Great question. The data that our local health department publishes is data with respect to individuals that are considered residents in our county. Having said that, we do perform laboratory tests for individuals that are not necessarily residents of Monterey County, and we make a distinction there in our data report in terms of the total volume of tests that our public health lab runs, and how many of those are for Monterey County residents and how many are for other county residents. And at this point, we only have 2 confirmed deaths for Monterey County residents or of Monterey County residents.
Okay, so that's testing data that you're talking about, but in terms of reporting actual fatalities, you're only reporting the number of fatalities involving county residents, regardless of where they were when they died.
The volume of tests that we are publishing is for all of the tests that are performed by our public health lab. And we make a notation as to how many of those are for Monterey County residents and how many are for other. The data that we published with respect to the number of positive cases and deaths and hospitalizations, et cetera, all that data is specific to residents of Monterey County.
Right. Okay.
Hey, Jim.
So
Jim, this is John Mineau.
Sure.
Can you hear me, Jim?
Yeah, I can hear you.
So just to close that loop further on as far as fatalities, if a death occurs in Monterey County, regardless of the person's county of residence, if it's a death in our county, we will report that from the office of the coroner. So whether or not they live in our county, if they happen to be visiting here, and if they expire in our county, we will report that on the coroner side.
Great.
Okay.
Any more questions for people who are on the line?
Just one more follow-up on the FEMA trailers. In terms of looking for a location, are you looking for one place to put all of the trailers, or would you potentially break them up at different sites across the county?
Yeah, Caitlin, we're looking at all options right now. We're working in conjunction with the health department, Dr. Mineau's advice, as well as we're working with all the hospitals too. We're, talking with them regarding patients that may be coming from the hospitals to be utilized in these facilities. So all options are on the table right now, and I cannot give you any specifics as far as which one is having a priority over the others.
I've also got a question about the FEMA trailers. What will they be equipped with? A lot of medical equipment, presumably, but can you give some specifics?
No, they are going to be used for isolation of patients, not to treat medically. So the patients that will be occupying the trailers will be able to care for themselves for the most part. So they are fully self-contained. Think of an RV. That's what we're basically being told what we're getting. So, they are between 27 and 30 feet long, and we'll be able to house, a family or multiples of people that have the same diagnosis.
And how will they get food? Will they be provided food in the trailer to make themselves, or will people deliver it to them, or what?
Yes, to both of those. The county has a food unit in the EOC, and we will provide 3 meals a day to the people there.
Are there any other questions? Well, we've got Gary. Any other questions?
Just a really easy one. What was the exact number of trailers you're getting?
I don't have an exact number. We requested 100, and we were told that we would be getting between 90 and 100.
Okay. Are there any additional questions for any of our county staff on the line?
Yeah, may I have one follow-up question?
Great. Go ahead.
Maybe. This is for either Elsa or John Mineau. Can you tell me if there have been any deaths in the county from coronavirus that are not county residents?
This is Elsa, and I do not have confirmation of that.
John, anything through the coroner's office?
Of the two that are reported by public health, one obviously both are county residents, although one did occur outside the county. So from a coroner's perspective, there's only one coroner's case that actually happened here in Monterey County so far.
You don't have a second reported, even another reported case. You just have one that went through the coroner's office.
So far, that's correct.
No. Anything reported, or I mean, would you get the report by now? If how long does it take to get the report? You would get the coroner's office would get the report immediately, right?
So if a decedent comes to the coroner's office, then we will actually start the process of trying to verify residents, next of kin, all of those things. And as you can imagine, Jim, we, as the coroner, we don't release anything at all until we know for sure that the families have been notified. So once a death occurs, that person will be transferred to us generally pretty quickly afterwards. But it's going to completely vary on how fast we can find and notify next of kin before we'd have anything we could report out on. But the two are the two. We only have one coroner's case in Monterey County so far, and obviously that we process coroner's cases every single day, so those numbers could change on a daily basis.
Was that one the one that came from Community Hospital, the Monterey Peninsula?
Jim, I don't have it in front of me as I'm telecommuting today. I can just tell you that one was from our county, and that's the only one that we dealt with. But I could certainly get some more info on that.
Thank you.
Okay.
All right, and then I'm going to turn it back over to our CAO, Charles McKee, for some additional information and a wrap up.
Thank you, May. I appreciate it. So in response to the question about ventilators, excuse me, my understanding is that the information I've gathered is that Natividad has approximately 26 adult ventilators. They have 50 of what they call disposable ventilators that can be used for short periods of time. When they say that, I think it's up to 30 days. And they have 12 additional machines that can be converted to ventilators. I don't have information as far as all the staffing needs that go along with use of ventilators, and also the medications that go along with use of ventilators, because I understand that patients have to be sedated to be using a ventilator. So those are the basic numbers on ventilators that Natividad has. And I also don't know exactly how many patients are currently using ventilators, if any.
Thanks, Charles.
You bet, Kelly.
All right, thank you all. Unless there are some additional questions, we'll wrap up our media briefing for today, and our next briefing will be on Wednesday. All right, we'll see you then.